Doctor, we talked earlier about people that need joint replacements as they get older. If they go down the road of a PRP, prolotherapy, stem cell treatments, can they possibly avoid those invasive procedures? And what kind of success do you see with the treatments that you offer?
Yeah. Most patients that come to see us are very educated. They've done their research. They know, okay, I've looked at a knee replacement, I've looked at cortisone shots, I've looked at PRP, I want PRP because. And their becauses are usually based on the fact that, when you're getting a knee replacement, your range of motion may not ever be the same again. You might have loss of range of motion. You'll have metal in your body now, so there's a lot of metal, ions that circulate through your body that we're finding now with blood draws, that once you get your knee replaced, you could have some metal toxicities from the knee replacement. Higher risk of strokes and heart attacks because you've had the knee replacement 21 times because of the surgery itself. There's a higher risk of complications. And the really interesting thing is I was at a talk about 2 weeks ago, and the talk was given by a surgeon who did in 2007 hundreds and hundreds of joint replacements. 2008, he started doing regenerative medicine, stem cell, PRP type injections instead of joint replacements. The interesting thing is he found that the group that had the joint replacement after 1 year, they still didn't have the range of motion back, they still had pain, and they weren't back to activities in sport. The patient that had the stem cell done in their knee, they're back competing again. They had better range of motion than the groups that had the surgery done, and they had less pain. So he had totally switched. He was no longer doing joint replacements because he's getting a better result during the regenerative work.
A lot of times you find people that do the knee replacements don't just have one either, if they're young enough.
Right. If you get it done too early, you're right, you may need a replacement 10, 20 years down the road, which is a harder thing to do.